I'm Sue Peckham.
And I'm James Holmes.
And we're the directors of Hampshire Hypnotherapy Centre in Southampton and Hampshire. Since 2004, we've been working on and developing a weight loss programme. It's our Easy Loss weight loss programme. And also, more recently, we've been working on the virtual gastric band programme that's really taken off and is now quite a large part of our business in the practice.
And really it's all come about, and when I first met Sue a long time ago, Sue needed to lose a little bit of weight. Quite a lot. And we developed a programme to allow that to happen, and Sue was enormously successful. She's kept the weight off, helped hundreds and hundreds of people also lose weight. And perhaps you should tell your story.
Well, basically, it was around about 2003, 2004 when we qualified as hypnotherapists. And one of the things that a lot of people consult a hypnotherapist for is weight loss. So I didn't feel very comfortable being able to say to people, I can help you lose weight, but I can't actually do it myself. And James and I sat down, we thought long and hard about what it was that was the problem for me, and then worked through a programme. It took us about 9 months, but in the course of that 9 months, I lost 3.5 stone and went down from a size 18 to a size 10, which is the size I still am today. And we developed a way of eating that's completely normal. It's not a diet. There's no calorie counting or weighing or measuring. You don't have to restrict any foods or exclude any foods. And it's very, very easy just to retrain once you know how. And there's nothing special about me. I just know how to do it.
And of course you can now practice what you preach. And
Absolutely.
I think that's so important for anybody to be able to do that. If they've done it themselves, can replicate that. Because you know how other people feel when people come in.
I do. And quite often I get clients come to see me in the practice and they say, you know, you just don't know what it feels like to be overweight. And I really do. I know exactly what it feels like. I know what it takes, the courage it takes to actually start that journey, having failed on so many diets before. So when you come to see us and, you know, talk things through with us, we're completely non-judgmental. We really do understand, and we really can give you the help that you need to address your particular eating disorder or your relationship with food issue.
And it doesn't mean you don't steal my chocolate anymore when I
Absolutely.
get presents, which you used to do.
Absolutely. I do still eat chocolate, just not very often. I just don't want it very often.
So one of the main things that's different about what we do is, I mean, Sue kind of covers the basics, the guidelines of weight loss, but we also look at the psychology behind it, what's gone wrong in the past, why perhaps diets have failed. And of course, when somebody's on a diet, and perhaps you're not successful, you lose weight, but put it back on again, then you try another diet, it gets harder every time you do that. It's like somebody who tries to stop smoking. If they try 20 times, the perception is the 21st time is going to be even harder. So what we do is we help people to manage their thinking really well, and in doing that they can improve their self-esteem, lower their social anxiety, and perhaps most importantly, gain what we call a locus of control. A locus of control essentially can be either internal or external. So we're aiming for an internal locus of control. With that, you can really gain a realistic assessment and overcome any kind of problems, because there's always going to be hurdles in life. There's always going to be hurdles when you're trying to lose weight. Maybe one week you don't lose as much weight as another week. So gaining a realistic perspective is ideal. People tend to think positive thinking is all I need, but in actual fact, in research done, positive thinking tends to be in short bursts. We prefer simply having a realistic appraisal over time, so that if they do have a difficult week, if they manage their thinking well, they go, well, next week I'm going to be even better. And of course, over time, you are always successful with that. And it's great to see what people can do, because they've got life skills outside of just, losing weight as well.
And it's one of the best things about our programme is that it's not hard, it's not difficult, it's just different. And when people do it in a different way, they are guaranteed a different result.
It's funny, one of the strangest things, because I was very fortunate last year that we saw lots of weight loss clients, kind of one after the other, and one of the things that when you do that, you tend to notice patterns. And one of the patterns I noticed was the people that were really, really successful, lost a lot of weight, said to me, "This is the easiest thing I've ever done."
And if you think about it, because you're eating naturally the way you really should, it is going to be easy. Something that we're particularly proud of is our 95% success rate in helping people to lose weight, because as long as they follow the program and work with us, there's absolutely no way they can fail. And people's achievement and the way they celebrate that achievement is really rewarding for us, and has gone on to, we wanted to think of how we could help more people that couldn't actually get to the practice, and we've gone on to develop an iPhone app.
Yeah, we've now got one of the highest grossing health and fitness apps in the UK, and it's growing in America and Australia as well. Virtual gastric band hypnosis - lose weight fast. There's something like 55,000 downloads now. And one of the great things about that is that we now have a Facebook forum where you can support the users of the app, and Sue and myself monitor that. I mean, you spend a lot of time answering people's questions on that.
I start at 6 o'clock in the morning sometimes because there's so many questions that come in overnight. But it's a really great platform for us to be able to help people who are just using our app on their own to actually get the correct advice, rather than lead each other astray with giving incorrect information. So we found that's really, really useful. And again, the Facebook group is growing really, really rapidly. It's something we're very proud of. The range of weight loss issues that we can help with is quite vast, really, because we can help if you just have a few pounds to lose, maybe you've been on a diet and you just can't shift that last few pounds, right up to people who are considering actual physical gastric band surgery. A lot of people come to us right the way in between because they've got a lot of weight to lose, very little weight to lose, just need to change their relationship with food. Some people just want to eat more healthily, and we can help with that. And then, of course, we can help with eating disorders as well. So people who are experiencing the symptoms of anorexia or bulimia, got a lot of experience in helping people to change how they feel about themselves, to learn to eat properly.
And of course, people's confidence levels, their self-esteem, if there's some social anxiety, feelings of being judged, and perhaps most importantly, if there's depression as well underlying, we can help with that. I mean, people ask us why we do what we do, and the answer is simple. There is no greater feeling than somebody emailing you, sending you a photograph, coming in, bunches of flowers and chocolates sometimes, and just saying, look, you have changed my life.
It's wonderful for us to see somebody that comes into the practice and feeling so low and depressed, their self-esteem so low, and within 4 or 5 weeks they're actually walking out on top of the world, feeling totally in control of themselves and feeling really good about themselves, and knowing that they've started on the road to becoming the weight that they actually want to be.
We've got the best job in the world.
We have.